This is J. Randall Wilkerson, author of the Heart Failure Recovery Plan, Successful Heart Regeneration Using Metabolic Enzymes. This is part 2 of a 58 video series covering the entire book, and part 2 includes the section titled How to Read the Book. You might think this is a minor point, yet it is rather important for patients who do have heart failure. In preparing the book, over 4 years of material collection was involved, and there were 2,000 pages of material and clinical studies. This was reduced to 153 pages of actual text, and in this book you will find 150 footnotes with 215 clinical trial citations to back up every recommendation. Medical terms and complicated words have been removed because most of the readers need to absorb the material in common English. Try to read this book in 2 or 3 days. Time is of the essence. Heart failure is a terminal disease that progresses steadily to the end, and you need to stop it as soon as possible. The book is a wire-bound type simply because when you grow tired, leave it open, and a wire-bound book will lay open right where you left it. Keep a yellow highlighter handy so you can mark any text that you find important, and you will find that this information contains quite a bit that is not found in any other book. There are many wildcards that derail clinical trials and cause them to fail, and so this book contains things that you must know to prevent these wildcards from preventing successful recovery. That's why this book is titled Successful Regeneration of Your Heart. When you complete reading the book, ask a family member or a partner to read it. You will need support from your family. And keep in mind, if you have class 4 heart failure, you may only have a few months left if you don't take action immediately. When I was discharged with class 4, none of the technicians or nurses would look me in the eye. They took one look at my chart and just commented to themselves, "He is a dead man walking." No other members of the heart failure group that year survived. I'm the only survivor. And my doctor explained to me it was because you created a treatment plan, a successful treatment plan. Each enzyme and supplement in this book has a value rating right under the title. Number 1 is critical to recovery and you must take it. Number 2 value is important to recovery, but you could dispense with it. Number 3 is helpful to recovery, and if you cannot afford it, then you do not need to take it. If you have financial limitations, apply them in the order of 1, 2, then 3. The dosages are listed for adults of nominal weight, and there will be weight ranges also included in the charts. As mentioned in the preface, you still need the very best cardiologist in your area, and you need to work with him. He may be skeptical of this treatment plan, but he wants to keep you as a patient permanently. A synopsis of the book under Chapter 1 is One Man's Journey to Recovery. It's a short story of how I developed the heart failure recovery plan. You can skip it if you need to proceed right away. Chapter 2, Causes of heart failure, is important information to find and fix the cause of your condition. If you and your doctor already know the cause, you can jump ahead. But please take note, there are many pharmaceutical-related causes that can cause heart failure itself, and you must discontinue them. A friend took an antidepressant prescribed from a walk-in clinic only a few weeks ago. Within 4 days, she had advanced heart failure, even more advanced than I was, and when she took one look at my book, she found that medication on the list of Chapter 2. It panicked her so that she discontinued it immediately, and it took several weeks to recover. But that particular antidepressant was known to cause sudden death. It interfered with the electrical conduction signals to the heart. Chapter 3 includes the supplement plans, and these include a single-page checklist of every enzyme and amino acid, vitamin, and supplement recommended in the book. Each page is charted by adult body weight ranges. These charts make it easy to start out right away. However, it is still good to read chapter 5 to learn about each of these enzymes. Chapter 4 covers detoxification. If you don't remove heavy metal ions from your bloodstream, many of these enzymes will not survive to give you any benefit. CoQ10, carnitine, many of these are destroyed right away if there's any mercury, lead, aluminum, and similar reactive metals in your bloodstream. Detoxification is possible fairly simply. Just review the chapter. Chapter 5 goes into the enzymes and supplements, detail by detail, and it is listed in order of importance, not by alphabetical, but importance. The first mineral is magnesium. That's the most important if you use the right type, the type that is absorbed through the cellular walls into the mitochondria. So proceed down that list and make certain that you obtain each of these supplements in their order of importance. At the end of the list, you will find a couple of items that are not vital for recovery, yet are often prescribed. We only included in this book supplements which had a very high percentage of effect at heart failure recovery. Anything that was less than 10% or 5% is considered close to the error band of the clinical trial involved. If you understand that, for example, 5% is the error band, then a 5% benefit may not exist at all simply because that just may have been the error. Chapter 6 goes into exercise rehab. A weak heart needs exercise. It is a muscle, and you must exercise it every day. When I was discharged, I couldn't walk 80 feet, but the very next day I walked as far as I could go. I made it to the neighbor's driveway. And the day after that, I made it to the end of the block. And the day after that, so on and so forth, until in a week I could walk around the block. At the end of 4 weeks, my doctor cleared my surgery for bicycling, and I covered 3 miles the first day. I'm not a great athlete by any means. I always scored in the bottom 10% of the President's Physical Fitness Test in high school. But you have to continue to exercise your heart and keep it conditioned from now on. Chapter 7 covers sleep. This is a largely overlooked therapy required for heart failure recovery. Plenty of sleep. Your body regenerates and your heart muscle regenerates primarily during your sleep due to a specific hormone condition that is blocked during the daytime. Chapter 8 covers the diet, the critical aspects of food and ingredients that can cause heart failure and those which can benefit regeneration. Chapter 9 covers the lifestyle choices we make. Some can cause heart failure, some can prevent recovery, so there will be changes that you have to make. Doctors often have the most trouble telling you to your face what changes you must make to survive. I don't have that problem. I can tell you. Chapter 10 goes into the medical aspects of heart failure. And you will find that there are many experts online that will try to discourage you from taking any action. Corporations have used people for profit for centuries, and especially in the past century. So you have to confirm for yourself every information in this book, and that is why it's so filled with scientific footnotes. In summary, when you receive this book, it looks small. It's kept small intentionally so that you're not put off by thinking that there are too many words to read. But it is written with decisive information, everything known today for recovery. You should take action immediately and proceed with the heart failure recovery plan. This book is available from Amazon in both print and Kindle editions, from the Apple iTunes Store as an iBooks in EPUB 3. It's available from eBay in a print edition, or you can order it directly from the publisher, Wilkerson & Hughes, P.O. Box 777, Altoona, Florida, 32702. Just send a check for $24, and that will cover the book plus shipping. Thank you again for listening. This is J. Randall Wilkerson of the Heart Failure Recovery Plan.